The official COVID-19 death toll in the U.S. has now surpassed 200,000, the most of any nation. That's according to Johns Hopkins University. It has been just over 8 months since the U.S. reported its first case. More than 6.8 million Americans have tested positive for the virus, but experts believe the actual number is much higher. So for more on this and all things related to COVID-19, let us bring in Dr. Neeta Ogden. She is an internal medicine specialist and immunologist. So doctor, let's just start with this dire, grave number of 200,000 deaths. At the beginning of this pandemic, that was kind of regarded as the maximum number of deaths. And Vlad and I were talking at the beginning of the show, and I remember when I heard that, I thought it was an error. Now the IMHE is now predicting over 378,000 deaths by January. What factors contributed to the U.S. exceeding those early predictions?
Well, good morning. And I know it's such a shocking number, and it really speaks to what we keep hearing about over and over again. Yes, this virus in some ways took this country by surprise, but we were slow to act. And we had mixed messaging from health administration and the government. It's sad to hear in the news that the virus was thought to be circulating as early as December of 2019. And then in Bob Woodward's book, we're all hearing that President Trump knew about the effects of this virus much earlier than the March 13 lockdown. So there were a lot of things that could have been done much earlier in terms of getting out a central message to people to be prepared, preparing hospitals with adequate PPE, doing many, many more steps than were taken. And even when we were in the full throes of the virus and lockdown, again, mixed messages about masks, mixed messages even today from the CDC. Unfortunately, it's too much for the country and a population to handle. I believe that it's important for us to treat this like an illness, like any other. We should have a standardized set of guidelines in place that just simply weren't there and could certainly have avoided such a high death toll. We saw that study from Colombia last spring that said just by using masks, I think 50,000 deaths would have been spared.
Yeah, doctor, it wasn't just mixed messages. It was false information. The president, yesterday, Kayleigh McEnany, the press secretary to the president of the United States, said, quote, the president never downplayed critical health information. Well, if you listen to the tape of President Trump speaking to Bob Woodward from March 19th, quote, I always wanted to play it down. The U.S. reached 100,000 cases in May, about 4 months after the country's first case was reported. Now in September, we've reached 200,000. The pace has not slowed down. Will it ever?
I think that if we could really get our hands on a very, very strict protocol, I mean, let's face it, no matter what you say, people are becoming slightly numb to these numbers, and they're experiencing pandemic fatigue, and they do want to get back to life and not have their businesses be so devastated. I think that if people are patient and keep the end in sight, because we are hearing news about both treatments and vaccines, that if we continue to wear face masks, socially distance, limit gatherings, limit indoor gatherings especially, and really make those steps that we're now seeing take place in Europe, which many of those countries are seeing, that second surge, we can contain these numbers. It's just unfortunate that you continue now with the election, people continue to politicize mask wearing. It's just astonishing. And so, you'll hear like, I support Trump, and so I'm not going to wear a mask, or people fighting over wearing masks in grocery stores. It just doesn't make sense. If we could eliminate that, and really just get to this basic idea that masks, social distancing, disinfection, that's actually going to get us to the place where we can continue to be normal. And then on the other end of that is if we can see scaled up testing, screening, and then more therapies.
You mentioned Europe kind of going through the second wave of the coronavirus now, and Europe is made up of many different countries. They approach the virus in different ways. I know Britain is sort of spiking a bit, France is spiking a bit, but then I think about what could happen here, because many experts have said this will not leave sort of in a complete stop. There will be waves. If we start to hit a second wave, what are your concerns, particularly when you think about the impact on our emergency rooms?
You know, a lot of people say that the United States never got out of the first wave. Let's face it, these states in the South and Southeast are, I think Miami-Dade is only now opening its schools. And even then, schools were being opened when there was still high community transmission. So I really don't know that we can even see it. Maybe we're talking about the Northeast where it was well controlled in terms of second surge. I'm concerned. I'd like to see data about PPE and hospital preparedness. I read an alarming article in the New Yorker about how the PPE was sort of being dealt with in the White House under Jared Kushner. It's alarming. What's the aftermath of that? I know that in New York, Governor Cuomo is mandating a 90-day supply in hospitals of PPE, or they could potentially lose their license, face fines. So things to worry about with the second surge, obviously, is that people continue to gather indoors and sort of feel that the virus is eliminated. Well, it's not. It's simply suppressed. The more that we spend time going out to bars, mingling, inviting people into our homes, the more likely its presence and infiltrating communities becomes inevitable. So we can't really lose sight of those things. And as surges continue, I think hospitals will be more ready. There's a vast network of doctors who've communicated about how to deal with coronavirus, especially in the mild stages. And even we have these approved drugs now. So it's a different picture from March, but we still need to be really on our toes about contact tracing. Many people report they go out for outdoor dining and there's no contact tracing. Very simple steps like smaller lockdowns, regional lockdowns, rigorous contact tracing and isolation. These are things that can actually keep that second wave from being out of control.
And yet, Dr. Ogden, there are some countries that are doing much better than the United States that have less infection rates. I know in particular Taiwan. I have some family there. They've only 7 people, to my last count, have died in Taiwan. There's 24 million people there on that island. They are in close proximity, obviously, to China. On a per capita basis, the United States has hundreds times as many COVID deaths as Taiwan has had. And part of the reporting that I've seen and part of the understanding that I've had from people who live there has a lot to do with the healthcare system and proper planning and preparation for pandemics, things that these countries, specifically Taiwan and other countries in Asia, have gone through in the past, as you know, with SARS and other infection pandemics, or maybe not to the extent, maybe pandemic is the wrong word, but they've seen cases of infections from diseases before and they've prepared for them. So what can we learn from what Taiwan is doing, what South Korea is doing, and apply that here, and understanding that we may not even have the political will, no matter how many case studies we look at in those other countries?
Oh, I think you're completely right. Taiwan was so prepared because of SARS. They sprung into action. They were able to do things quickly and efficiently. And let's face it, the Taiwanese people were on board. There wasn't this questioning about masks and testing. They were prepared with more testing. I'm very concerned that in the United States, again, we still have our national health organizations and administration like the CDC, changing their mix, giving the mixed messages, changing their messages on a weekly basis. The FDA's guidelines are being undermined. I mean, we need, and then there's also inconsistent data reporting, things that we can use to track the virus. I think that I'm really hoping, and yet I don't hear enough about a more nationalized, standardized surveillance system for pandemics, as well as for COVID-19. Unfortunately, America is really driven by private businesses and individualism. So we see a lot of effort from private organizations in so many innovative ways, from the vaccine to testing. But the government hasn't brought these people together. There hasn't been an activation of the Defense Production Act that would have led to large scale, testing being available. These are the kind of things, that's not creating a network that could unify the control of COVID-19 in this country, much less for a future pandemic. So I really do hope that that's happening in the background. I just haven't heard or read enough about it of late.
Yeah, I think we're all hoping that that's happening in the background.
Yeah, indeed. Dr. Neeta Ogden, always great to have your analysis. Thank you so much. We appreciate it.
Thank you for having me.